everyone. Let us discuss about aphorism 72. In aphorism 72, Hahnemann talks about preliminary view with respect to the first part. First part is how to ascertain the knowledge of disease. So as to ascertain the knowledge of disease, we must know what is acute disease and what is chronic disease. And Hahnemann gives us some guidelines to tell us what do you mean by acute and chronic. So let's see what do we mean by acute disease. Acute diseases have got acute morbific process. Acute morbific process is like, for example, there's an inflammation. So what we see is runs in a particular way in almost all the individuals. That is like it gets reddened initially. There's a lot of pain, and then that goes into suppurative phase, and then it goes into healing phase. So there is a particular morbific process, and usually it will be of short duration. It must have started somewhere 2 to 3 days back, 1 week back, 15 days back, something like that. It is not taking years together. It takes a moderate time. Usually they have their own course. They have tendency to finish the course, and then it takes moderate time to get cured. In chronic diseases, we find that they have got a small and imperceptible beginning. So what do you mean by imperceptible is, like for example, because patient is suffering since many years, patient doesn't know that how it has started. If you try to trace the cause of the disease, it becomes very difficult. They say that it has started somehow, and this shows that there is a imperceptible beginning. Gradual deviations. For example, a patient coming to you with the constipation, then he ended up with the hemorrhoids, bleeding piles rather. Then if you ask them when did his constipation starts and how many days he suffered, and then when did it turn into, means when did he started suffering from his bleeding piles, they don't remember when it happened, how it happened. All these details they will not be able to use because there are gradual deviations. So all these chronic diseases are caused by dynamic infections, and they are caused by chronic mild. So in case of chronic diseases or any disease for that matter, whenever vital force senses that there is something wrong happening to the body, it opposes initially. As the disease progresses, resistance of our vital force becomes imperfect, unsuitable, and useless. Okay, because of this, vital force will not be able to extinguish this disease, but it is helpless and it starts suffering. And now what happens is disease starts spreading and vital force gets deranging, means like the disease spreads and it goes on progressing till the organism gets destroyed. The basic quality of chronic miasm is it goes on getting worsened till the organism gets destroyed. This is how Hahnemann has given a preliminary view for acute and chronic diseases. Okay, thank you.